So patient safety, why is it so important? We talked a little bit about the chemo underdosing and what that meant. And we talked about the Sexual Abuse Task Force. And I want to share with you a story about patient safety and why it's so important for us. Last year, so it was a year ago, there was a beautiful little boy, and his name was Andrew Sheldrick. And as a result of a compounding error in a pharmacy, this little boy is no longer with us. I'm sure folks have seen a lot of that in the news, and it speaks to the need for us to look at our system systemically and the processes that we put in place and how we're able to protect as much as possible the public. We recognize that there are errors that are going to be made. We recognize that our systems are not perfect. But as we move forward, it's important that we always remember that no matter what we do, there is a patient at the end of every prescription. And when we remember that, you think about that patient at the end of that prescription as your child, as your mom, as your spouse, as your sibling, right? And you think about how would you advocate for them, and how do we together prevent this sort of thing from happening in future. But it's important that we take a look at this, and it's important that we look at our own systems and find a way forward. There's data out there that show anywhere from 5 to maybe even 50% of emergency room visits are a result of a medication incident. It's not only pharmacy, though. When you take a look at the huge chain, right? What happens from the point that a patient is given a prescription right through to the point they begin to take that prescription, and what happens afterwards, right? So when we're looking at all of these things, we know that there's a bigger system at work. We know that we have to actually work on this together collaboratively, or we're not going to get anywhere. But it's important. And when we take a look at things also like the opioid crisis, it took 20 years for us to get here. 20 years. Look at the crisis we're in right now. And you think about the lives that are lost as a result of that. And how have we as healthcare professionals contributed to that or not? Right? So when we're looking at all of these things, we know that there's an opportunity that we can do better, and we need to work together in order to make that happen. But always remember that at the end of that prescription, there's a patient. Someone's life depends on this. Right? So the next piece I just want to show with you why it's so important. So numbers matter. Every 17 minutes, someone dies in a hospital from an adverse event. That's equivalent to 31,000 people per year. 1 out of 18 hospitals visits results in a preventable harm or even death. And when you take a look at home care, 13% of people getting care get some sort of a harmful event, such as a fall or a medication error. 50% is the World Health Organization's global target to reduce medication incidents by 50% within the next 5 years. How are we going to do that? This is something that we're taking on worldwide. It's not just Canada, it's not just pharmacy, but we need to work together on this. And 1 is the estimated number of deaths per day in the United States due to medication errors. That's a lot. And if you translate to Canada, that's 1 in every, approximately 10 days, right? So you think about it and the importance of making sure that as pharmacists, we do what we can, because medications, there is a huge impact. Over the next little while, or rather over the last little while, I should say, the whole system has been looking at patient safety. And it's not just pharmacy. We are playing a greater and greater role as folks actually recognize the impact that medications have and the role that pharmacists and pharmacy technicians have in that, in helping to make the system better. So we have this patient safety. You see the organizations that are involved. And along those same lines, Patient Safety Week is next week. And so at this time, I just want to take a moment and recognize all the hard work of our teams around the medication safety. We've actually just, if folks have kept an eye on the news today or gone onto our website, you'll see that we've just announced the winner of the RFP for the medication safety, and it's around the mandatory reporting. And we'll be working with Pharmapod in partnership with the CPHA in order to implement the mandatory reporting across the entire province. What does that mean? It gives us now an opportunity to be able to understand what's going on out there and to be able to work as a system to address some of those concerns, right?